Education is a powerful tool. When that is combined with gentle and reassuring encouragement, the result you get is a more trusting people. There was tangible evidence of this during the first 2 No Movement weekends, where people came out to take advantage of the pop-up clinics that took place in every parish. Teams of doctors, nurses, volunteers from SGU, officials from the General Hospital were in various communities in St. Andrew, St. John, St. Mark, St. David, St. Patrick, and St. George. In St. George, there was an impressive turnout at the St. Paul's Community Center on Sunday, September 19. GIS spoke with Dr. Taisha Donald, the driving force behind the initiative. Dr. Donald, who is originally from St. Paul's, worked with Parliamentary Representative the Honourable Gregory Bowen and representatives from the St. Paul's Sports, Cultural and Development Organization to encourage people in the village to get vaccinated. Needless to say, she was pleased with the response. She believes people are beginning to understand the importance of vaccination.
The majority of persons who have died from coronavirus in Grenada, in our hospital, have been the persons who are unvaccinated. And I think this message has been out there, and I think persons have now made a conscious effort to decide, hey, let me do this. Let me get vaccinated. Let me help protect myself and my loved ones. So I think the message is getting out.
As the Acting Director of Medical Services at the General Hospital, Dr. Donald knows only too well the pain that is being brought to bear on families who are losing their loved ones to COVID-19. More than 100 people have died from this dreaded virus within a 3 to 4 week span, ranging in age from 18 to 103, with a significant percentage of that number being unvaccinated.
As a healthcare provider, getting these calls just to say someone has died, and in one day getting more than 5 calls like that, let me tell you, it's a nerve-wracking type of feeling. You feel overwhelmed. You just want to cry. You want to scream, really, because it's sad. Because, we could have been a little bit more responsible to help prevent this. Because when we assessed all the persons who were in fact dying, the majority of them were unvaccinated and had underlying conditions. So it was painful, I have to say. And for all the persons working with the COVID patients, it's been very, very emotional and nerve-wracking for them. But we want to make sure we give our best and do our best to take care of the patients to the best of our ability.
While the numbers of those who have turned out to be vaccinated during the first 2 No Movement weekends may still be relatively small, they are nonetheless encouraging. So too are the numbers for those who are recovering, which are now more than 2,600. The activity at St. Paul's was the result of more than 6 weeks of hard work. Honourable Gregory Bowen, MP for St. George South East, is happy that the number of vaccinated people are increasing, and he complimented the many volunteers who work with those on the front line for assisting in this vein.
I'm taking courage, I'm heartened, and I know the numbers of vaccinated people have been increasing, and I'm very, very happy that. So kudos to everybody. There are many people who said, well, I don't know, I'm not taking that 6 weeks ago, but I've seen many of them here today. And I want to encourage them. And as I've told them in the opening, they must be emissaries now and ambassadors to go out and tell the others who were like they were before, indicating that they're not too sure. And they're here to ensure that everybody is sure and come out and take the vaccine now.
Playing a key role in the mobilization drive was the St. Paul's Sports, Cultural and Development Organization. Chairperson Brian Pivot told the Government Information Service they wanted to provide the right environment for people in the community to get tested and to even feel comfortable to take the vaccine. He said the organization was no doubt pleased with the response.
We realize that the country as it stands now, we are in a crisis situation. It is not business as normal, and every individual have the role to play. And our organization, being a civic-minded organization, we felt it necessary to approach the ministry to assist them in making it easier to reach out to our community, right? And we are hoping that other organizations in the Grenada could see it fit to engage the community. Because, as I mentioned before, we are in a crisis situation in this country, and we cannot We cannot and we should not just continue living as normal. It's a start in the right direction, and we hope a lot of people will follow suit. Right? And the St. Paul Sports and Cultural Organization is an organization operating more than 20 years now, right? 20 years plus. And we have what we call good human resource in the organization. And we are hoping that our involvement in it would propel other people in the community and elsewhere to come out and know the status, and if need be, if they want to take the vaccination, to take it. That is our position.
Dr. Kenneth Carter, who was part of the COVID response team led by Dr. Taisha Donald for the vaccination drive in St. Paul's, said while there is still vaccine hesitancy generally, they were heartened by the turnout of the community.
There is still some vaccine hesitancy, but it's a step in the right direction. More people are coming out, more people are getting vaccinated. People are still asking questions, people are hesitant. A lot of people are getting tested before they get vaccinated as well. So it's a step in the right direction. I think more people should come out and get vaccinated. At Nature's Bay in Laurellands, we did a mobile clinic again with vaccination and testing. And there was a really large turnout from the Penmouth, Windsor Forest, Vincent, St. David's community. So yeah, we had 230 people, I think, total at the end. And we did testing and vaccination. We probably vaccinated, I'm not sure the exact numbers, but there was a large turnout for vaccination as well as testing.
But you were satisfied with the turnout in that area as well?
Yes, definitely. It was there from 9 to 2, and we had constant flow of people from 9 to 2.
GIS also made a brief stop at the car park of Foodland Supermarket at Kirani James Boulevard, where another vaccination clinic was being conducted. There we met with Minister for Health and Social Security, the Honourable Nicholas Steele, who said there was a good turnout at the site, as well as in the Limes, Montu and Grand Dance. He was happy that many of those who tested negative opted to take the vaccine on site, in the process equipping themselves with the best tools for Grenada to overcome the challenges associated with the virus.
We are suffering a fate that almost every other nation in the world has, and the solution is the same for every nation in the world: to vaccinate as quickly as possible its population so that we can protect as best as possible our population. The activity has to continue. The testing in the clinics must continue because we're not at that goal vaccination-wise, and we will have more persons testing positive. So yes, that activity, the Ministry of Health activity, will continue.
We also spoke with Medical Officer Dr. Mayana Charles and Forensic Scientist Janelle Hines, both of whom are happy that people have been coming forward to get tested and vaccinated, and in the process protecting themselves and their families.
If we continue on this path, I think it will put us in a really good place. I think we will be able to peak and we'll soon start to see a decline in cases. So yeah, it will put us on a good path because that increases overall immunity through vaccination, which is what we want. So it is really a good trajectory for us going forward.
Over the last 3 weeks, we see that to get the vaccination works. I've had a close friend who, she was the only one that was not vaccinated, living in a house with 3 other people that were fully vaccinated. She had a medical condition which prevented her from getting vaccinated right away. So anyways, it turned out that she was really, really bad, and her symptoms was really, really bad. But the people in the house, because they were fully vaccinated, they were negative. So, the vaccination does help. So I would encourage people to get the vaccine as soon as possible, because we see that, once you are not vaccinated, and you don't know if you have underlying conditions that will cause it to be very, very harmful, or you can actually die. So I would suggest that people get the vaccine as soon as possible.
During the first 2 no movement weekends, close to 2,000 Grenadians were vaccinated, just over 500 during the first weekend and a further 1,300 during the second weekend, opting for either the Pfizer or AstraZeneca vaccine.